all lanes open as we head on 526.
More than 100,000 people in our state have tested positive for COVID-19, and more than 2,000 people have died. With schools welcoming students in just a few days, South Carolina, are we still flattening the curve? Well, joining us live from Washington is the director for the Centers for Disease Control and Prevention, Dr. Robert Redfield. He will help us navigate going back to school, reopening businesses, dealing with isolation, as well as safely socializing. Dr. Redfield, thank you so much for being with us. Dr. Redfield, thank you. We appreciate your time. We know you are very busy right now answering a lot of questions, and one of our questions is, there was a startling statement that came from the State Health Department here in South Carolina last week that more people have died in South Carolina of COVID-19 during the past 5 years than over the last 10 years of flu. Is that alarming to you?
Well, I will say in general, flu is a very serious upper respiratory tract infection. Over the last 10 years in our nation, we've had about 360,000 people die of flu, just to put it in perspective. Now we're up around 165,000 people have died of COVID so far this year. So I want people to understand flu is a very serious respiratory infection. The advantage of flu, we do have a vaccine that can prevent it. Unfortunately, only about half of Americans take advantage of that vaccine, and we do have, obviously, treatment for flu. COVID right now, our most powerful weapon for COVID, and it also works for flu, is we could get everyone to universally use a face mask, face covering. We wash our hands, we social distance, and we're really smart about crowded places. Those interventions will really work for both viruses. And then additionally for flu, I'm asking individuals to really look at accepting the flu vaccine with confidence.
Dr. Redfield, South Carolina was trending down for several weeks when it comes to infection rate. We had a slight increase over the last few days when it comes to infection rates. With schools opening up in just a few weeks, children will wear masks, rooms will have plexiglass, they will wash their hands, and there will be social distancing. But can you really control the spread when you put children and staff together?
Well, again, I think if we really all practice that social distancing that I talked about, and the use of masks and hand hygiene, and being smart about crowds, obviously, and preferring outside rather than inside. South Carolina does have a significant transmission of COVID right now. You have 62 of your metropolitan areas or counties have greater than 10% of all tests that are positive, which we use as the criteria for what we call high transmission, red zone transmission. But you are getting better. You have gotten better over the last several weeks. In the last week, you declined by about 1.7%. But there is significant transmission in South Carolina. And that's why, again, having people really take serious the idea of a simple face covering like this is a powerful weapon. It really works. And to really social distance, wash your hands, and be smart about crowds. That strategy really works, and this is what we're hoping to see. Jurisdictions that are still in the red, like South Carolina, will start to fully embrace.
If you're talking a lot about the transmission rates and people being together, one of the areas certainly we know that there's been a lot of change on a daily basis, announcements about fall sports. There will be games, perhaps fewer games, but thousands of players and fans will be at these events. What is your recommendation?
Well, I think the most important thing for our society right now, and it's in our best interest of our society to work towards face-to-face learning and in a safe and sensible way for our K through 12s. I mean, I think this is really the priority. When it comes to sports, I really do think we have to avoid significant gatherings right now. If one is to go to a sporting event, one needs to maintain that social distance, 6 feet. When they can't do that, for sure, they need to be wearing face coverings. But I will say, if you take priorities right now, what we as a nation need to do really is to focus on getting our K through 12 schools reopened in a safe and sensible way.
Dr. Redfield, one quick question. We know that the CDC released a report today and it focused on young people and rates of suicide and depression, and we noticed an increase in that. What are you saying to young people as well as to anyone who might be feeling isolated right now?
Well, I think it's important you brought it up. I mean, it's really an issue. A lot of people are seeing exacerbations of their mental condition because of isolation, depression, suicide gestures. Obviously, asking people to seek the support that they can get. You know, when you look at schools, this is another reason I try to advocate that schools aren't only important for the child's academic success. Schools provide mental, nutritional, emotional support for children and their families. It's another important thing for us to get these kids back into an environment where they can socialize. But we were trying to highlight for people to be aware that in this time of isolation, we need to provide support to each other to try to help individuals get the care that they need. There is an increase in suicide. There is an increase in suicide gestures. There is unfortunately an increase in drug overdose, particularly among young adults. It's important to try to make sure individuals that are depressed are getting the support from other family members, because this has been a long isolation period for a lot of people.
Dr. Redfield, this pandemic is caused by a virus that we didn't even know about this time last year. Do you believe it's likely that we might have a vaccine of some kind within the next 6 to 8 months?
Yes, I think I've been in vaccine development most of my professional career. I've never seen more purposeful, decisive, private-public partnership. The president's leadership on this really sort of setting the goal line to get the mission to get a vaccine by January 2021. I think many of us back in March, April thought that was going to be a high bar to find, but I will tell you, as I sit here today, we have 3 vaccines in phase 3 trials, which are likely to have data about their safety and efficacy in late October, early November. I think I'm very cautiously optimistic that we'll have 1 or more vaccines before the end of this year.
Doctor.
And that said, I don't want to undercut, though, the need to do that social mitigation of the mask, the hand washing, the social distancing, and the smartness about how one gets in crowds. We need to do that as we wait for the biomedical solution, which I do think will be coming before the end of the year.
Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, we certainly appreciate your time.
Well, thank you very much. God bless you.
Thank you, and God bless you.